The global COVID-19 death toll hits 4 million people. The U.S. with the most deaths worldwide at more than 606,000. In the U.S., the Delta variant continues to spread rapidly, and communities with lower vaccination rates are seeing an uptick in cases. Those communities are also seeing hospitalizations surge, and those are linked to the highly contagious Delta variant.
While we were seeing evidence of herd immunity before the Delta variant hit, right now cases are going up. We absolutely do not have population immunity against this variant.
As for travel to the U.S., Transportation Secretary Pete Buttigieg tells Bloomberg President Biden isn't ready to lift international travel restrictions just yet. Health officials make it clear the COVID vaccine is effective against the Delta variant, but the numbers are lower than scientists first hoped. That data is early and coming from different parts of the world, but a new study out of Israel is showing lower efficacy against infections. Israel is actually a good test case for us to look at because it has been super aggressive with its vaccination campaign, and a majority of the country is now vaccinated. In a new study there, the Pfizer vaccine was found to be 64% effective at preventing infections from the Delta variant, which is quite a bit lower than the 90% rate against the original strain. But this lower rate is mostly looking at mild cases of infection. The study also found the Pfizer vaccine to still be about 93% effective against severe cases and hospitalizations.
Occasionally, you'll see one study suggest, well, maybe it's not as effective as we thought, but all the other studies so far are showing 85–90% effectiveness. It's really quite terrific, and I think it offers a very high level of protection, particularly against getting very sick and dying, which is the thing we care about.
It's important to know Israel hasn't released the underlying data from this study. Pfizer told our sister station they won't comment on unpublished data, and this isn't the last word because researchers have to test out a lot of different factors that can impact infection rates. Two other studies out of Britain and Scotland found higher rates of efficacy, 88% and 79%. Plus, collective vaccination also has its own protective effect. The more of us who are vaccinated, the less opportunity the virus has to mutate and form vaccine-resistant strains. Here's a quick look at Iowa's vaccination numbers. More than 1.5 million people in Iowa are fully vaccinated, and nearly 3 million doses have been given in the state. More than 2.8 of those going right to Iowa residents.